Well, today on the show, we're in Picayune. We're up here in Pearl River County at Covenant Health and Rehab. Now, when it comes time to searching for maybe a nursing home or a rehab facility in the Pearl River County area, this is the place to come to. So we're going to go inside and meet some of the wonderful staff here and show you why you should choose Covenant Health and Rehab when the time comes. Hey, Carrie.
Hey, Jim.
How are you?
I'm good.
Carrie Ladner is the administrator here at Covenant Health and Rehab. Give us a little bit of background, if you would, about Covenant Health, how long it's been here and everything.
Okay. We've been providing services for 45 years. We provide skilled rehab, physical therapy, occupational and speech therapy. We also do IVs, wound vacs, just skilled care in general.
Now, are you also a nursing home?
Yes.
Okay.
We have short-term patients and long-term.
Now, those coming in perhaps needing rehab for something, I guess like surgeries, maybe that somebody blew out a knee or a hip or something like that, so they can come in here and go through rehab without actually having to stay here, I guess.
Right. The average length of stay is usually 45 days for a rehab patient, and they actually go back home to live in the community.
So that just helps them get them back on their feet.
Yes.
And Covenant Health has been here, for, like you said, for a number of years.
45, yes.
45, and the people of Pearl River County, really find it a nice, friendly place. And in case they need to know exactly more about what you do have to offer here.
Yes.
And what it costs, what not the cost, but what it takes as far as admissions.
Yes.
So we're going to talk to your admissions director now,
Shauna Whitfield.
Shauna Whitfield, and find out more what they have here to offer at Covenant Health and Rehab. Shauna Whitfield, how are you?
I'm great. How are you?
I'm great. Shauna is the admissions director here. And give us a little bit of information, if you would, about the admissions process, if you would.
Okay. When you are admitted into the hospital, you'll be assigned a social worker or a case manager that'll follow your care while you're there. They will ask you what your discharge plan is. When you admit to the hospital, they start the discharge process. And if your discharge plan is to come to Covenant for skilled nursing care, you can let the social worker or your case manager know, and they'll get in contact with me and send us the paperwork, and we'll review everything and make sure we can meet all your needs. And then when your hospital stay is complete, you'll come here and start your therapy.
So they can request coming to Covenant.
Absolutely, yes. They can request. The social workers and the case managers at the hospital also have lists that they can provide the patients, and the patients can choose from that list of facilities in the area.
Now, one of the big things, as you mentioned about, is physical therapy.
Yes.
Going through treatment and everything. So I guess we want to go back and check out one of the physical therapy rooms.
Yes,
here
go look at therapy.
Yeah, we're going to check that out here at Covenant Health and Rehab in Picayune. Well, welcome to physical therapy. Danae Thorne is their physical therapy assistant. How are you?
Hi, I'm good. Thank you.
Well, thank you for having us in here. We were talking earlier about some of the different things that they have to offer here at Covenant, and of course, I know the big thing being physical therapy.
Yes, sir.
In recovery from surgery or whatever. Tell us about some of the different things that the patients can do here.
Okay, we have the parallel bars we use for gait training, teach them how to walk again, for transfers in the home, outside of the home, things like that. We also have Omni cycles that are considered active passive bicycles that we can set up a patient. If they're not able to move it themselves, there's a setting that the bike can move on its own and carry them through their range of motion.
Nice.
We have a new step by the wall. For our higher level patients, it allows them to work on their strength and range of motion as well.
Looks like that probably would work well on the knees and hips.
Yes, it does. And also works good for the shoulder because you have the arms that are movable
yes,
as well.
like an elliptical.
Yes, like a seated elliptical. Very good.
Oh, I love that one.
We also have a standing frame called an easy stand that allows us to transfer patients to that are not able to stand on their own.
Right.
And we crank it up and allow them to build up their standing tolerance.
Wonderful.
Using that machine. We also have occupational therapy here as well. Occupational therapy works on activities of daily living, and they do things such as the shoulder arc or putting like fine motor grasp type skills. They have different equipment over there for that.
And you actually have a little kitchen area set up
Yes,
that
we do.
you for whenever they do not so much occupational skills, but skills to help them around the home.
Yes, we do simulated home assessments that allows them to simulate cooking, simulate laundry, different activities like that to allow them to return home back safely to their environment.
That's awesome.
As well.
That's awesome.
We also have the Omni VR. It's a virtual rehabilitation machine that we use. We can use gait training for their being able to act like they're walking on a street. And they also can do exercises on that using that machine as well.
That's cool.
And then we have speech therapy also.
Okay. Well, they have some other great things. They got great nurses here as well. We're here at Covenant Health and Rehab in Picayune. Carrie, you got a great nursing staff here.
We do. We have a lot of longevity with our staff and really hardworking and dedicated employees.
And a couple of nursing stations, actually?
Yes, we have 2 stations. We have 60 beds on each side.
So that way they can keep a close eye on both of them. This is the dining room area, and a lot of great nutritional meals made here. And y'all take a lot of pride in catering, so to speak, to your patients.
We try to follow the request of the patients, what they like, their dislikes. We also follow the physician's orders. We have a dietitian that works closely with us, and we have a dietary manager that runs our kitchen.
And you, I guess, 3 meals a day?
Yes, 3
Breakfast,
meals a
lunch, and
day,
dinner?
2 snacks, and then if they want anything else, they're free to request that at any time.
Okay.
Okay.
So what kind of, let's say any given day, what could it be a good dinner?
Meatloaf, mashed potatoes, gravy.
Oh, good country style
yeah,
dinner. Oh,
yes.
they feed them good down here.
Yes.
That's really good. That's really good. And as you said, because of the different types of special needs, you work closely with the dietitians, with the doctors, with the patients, and make sure they get the great. And y'all got a great notice or something. You won an award.
We did. We got Facility of the Year. We were chosen from 49 facilities in 11 states. So,
Really?
yes, we were excited.
Well, congratulations
Well,
to
thank
that.
you. Thank you.
It's really nice place here. I mean, we're going to step outside and show you more of the wonderful staff they have here at Covenant Health and Rehab in Picayune. Now, tell us, if you would, Carrie, if someone wants some more information about Covenant Health and Rehab, what do they need to do?
Contact Shauna Whitfield. It's at the facility. The number is 601-798-1811.
Okay, and the number is on your screen, so if you'd like some more information, but if they like to check things out, they can come up here as well. They're located on Reed up here in the lovely little community of Picayune. If you need some help, give them a call.